Workers in the death care sector say they're currently experiencing the most stressful time of their careers. People who care for the dead aren't deemed essential workers, and even though they're working with the bodies of people who've died from coronavirus, they've not been given priority access to vaccines. Researchers at Melbourne University believe death care workers like embalmers, cemetery staff and celebrants need more support. Iskandar Razak reports.
These are the people who take care of the dead. Morticians, funeral directors and celebrants. It's hard, hazardous work.
COVID-19, I think, was the most difficult time that I've experienced in 35 years in the funeral industry.
This time last year, every second service that I was leading was for someone who had died of COVID.
In Victoria, 800 people died after contracting COVID-19 in 2020. Tobin Brothers cared for 300.
Obviously around for HIV, SARS, but nothing on this scale. Yeah, nothing on this scale, no. It's quite relentless.
They bought their own PPE, created specialist teams and worked nights to minimise community risk and keep services going.
That's our job. Regardless of the infectious state and all that sort of thing, it's still our job.
And it's not just those who touch the bodies of the deceased who are in danger of catching COVID.
I led a service for a family and 4 of the people in that family tested positive for COVID. Their father hadn't died of COVID, but he'd been in an aged care facility where there was COVID, and they had gone in to visit him in the aged care facility and picked it up.
There isn't just a physical need for burials and cremations to keep going, even in the middle of a pandemic. There's an emotional need as well, that if left unaddressed can have really damaging effects on not just individuals, but entire communities. Despite that, a report by Melbourne University's Death Tech team examining the industry found governments do not give the workers in the sector the support they need.
Death care workers did not receive, for example, access to testing early on in the pandemic. They still haven't received priority access to vaccinations, which means, despite them often going into aged care and healthcare services to pick up decedents, they don't have vaccinations necessarily.
The report calls for greater recognition of death care workers and more physical and mental support.
Yeah, it would have been nice, but to be fully vaccinated by now.
But workers say even if nothing changes, they know their work is essential and will do their best to ensure people have a COVID-safe way to farewell their loved ones. Iskandar Razak, ABC News, Melbourne.